Hi, this is Dr. Mark Sehl. I wanted to talk to you about my new group coming up, Psychotherapy Training Group 2. And instead of writing about it, I thought there were certain clarifications I wanted to make, so I wanted to do in the video. I don't mind doing videos. So it's Psychotherapy Training Group 2, and it's next Tuesday at 7 to 8:30. But one of the things that I thought might be confusing is the free speak part. There's two sections. One is integrating, talking about a case, and we take off on a problem that somebody talks about that they're having with a patient, and that's a good place to start rather than a long history. Start right where what the problem is, and often that could be a countertransference problem or not, but that's how we start that case discussion part, and we're trying to integrate technique and what interventions can be most helpful in helping someone get unstuck in a case. And many of us do. I mean, I do. Many of us don't know where to go. There's something blocking us to make progress forward. So that's part one, and that usually, they're divided into two 45 minutes sections. The other section is the free speak part. So the task is to say everything that you can humanly do, say out loud without hesitation. And the reason being that what we can't say out loud, we cannot help our patients say out loud. And saying something out loud in the group is very difficult, more challenging, but more worthwhile. That's usually the things that we can try to do that are difficult are the things that we learn the most about. I was just doing a podcast on breaking out of the box, and I gave a description of one time I went on to the Carson Daly show, and my blind psychoanalyst friend couldn't do it, so he said, "Do you want to do it?" I said, "Sure." And the minute I said sure, I was terrified. But when I walked down to the stage, I did it. I had a comedian, Andy Dick was my foil, and he was really out to rake me over the coals, and he did, and so what? I mean, it wasn't, if I had to do over again, his name was Andy Dick, I could have said something like, "Now I know how you got your name." I didn't have the wherewithal, I didn't think about doing that, but anyway, the important point is that I did it, and it's a memory in my memory bank of a confidence builder, and it really built my confidence. So that's what this group is all about, but it's not that you're going to talk free speak for 45 minutes. It's not that, and I think that people probably don't know what it's like, so I wanted to move this video into you so you can hear about it rather than me writing off a line. I don't know how I would write about it, but so what that means is the free speak moves in and out of the an hour and a half time that we spent together. So at any point, somebody can say something spontaneously that was on their mind and that they were timid about saying, that they had shame about saying. Shame is a soul killer. So you really get strong by saying things that you're afraid to say. One time I had somebody in the group, and she went missing for 2 weeks. So I called her up and I said, "Well, what's happening?" And she said, "Well, I'm embarrassed to talk about what my feelings were." So I said, "Come in and talk. You can do it. I'm sure you can do it." She did, and she came in and talked about her sexual feelings that she was having toward a male patient. And the minute she did, people started to talk about how they had similar feelings, and her talking about it made it comfortable for them, and she in no way got judged by me or anybody in the groups. They're very supportive groups. And I don't allow people to judge in the groups. I want them to get the experience of listening and accepting and removing judgment. And that's the way we do therapy the best. So again, that free speak part can move in and out. You can have something that occurred to you during listening to a case that's all of a sudden interests you. Oh, I had this reaction, either to the person who was presenting or to the person who was being presented. And I want to be curious about it. I want to find out more about it. Why did I have that thought? This is real what therapy is all about, isn't it? You want to help your patients do the same. Because if they can free speak freely, spontaneously, they will get healed. They get strong. So, and I've had 16 years of doing this with one of my mentors, Dr. Jerry Lucas. He was a wonderful, he was a modern psychoanalyst. We can learn about that too. You can learn about you learn a lot by coming here because you don't know what modern, maybe if you hear the word psychoanalysis, you might be put off. But psychoanalysis has changed a lot. And I wrote a letter to the International Psychoanalytic Association and was published in the New York Times that I said, psychoanalysis should not be defined by frequency of visits. I mean, you can if you want, but it's cutting out a lot of people who could go into training but they can't afford it. You can't go 3 times a week. Both the people who want to learn about psychoanalysis nor the patients. You segment out a whole wild birth of people who could really benefit. And modern psychoanalysis has nothing to do with frequency of session. It has all to do with how you use yourself in your sessions, being able to be comfortable with your emotions, and it's a lot about the emotions. It's not an intellectual process about when you study modern psychoanalysis. You know, back in the 50s, Hyman Spotnitz, he started the movement of modern psychoanalysis, and the reason being is many people at that time would not see people who didn't have an object transference. And he said, well, they don't have an object transference, they have a narcissistic transference. And he learned about that, and he taught it, and he helped people, many people who were just rejected out of hand because they're like psychoanalytic institutes. They often will not accept people because they don't have a certain structure, ego structure, that they can benefit from. They think it's not true. That's their perception. I don't think it's true. You can work with anybody you can work with schizophrenia in a psychoanalytic manner, as long as you, depending upon how you define your psychoanalytic interventions. You know, that's what good therapy is all about. How you intervene. Can you observe your patient's interactions with your their reactions to your interventions? And if you can do that, you've got a lot of things licked. And sometimes students don't want to observe because they don't want to elicit any negative reactions from the patients. That's one thing that you can learn a lot about by being here and speaking out loud, because you'll get used to your own negative reactions and be able to say them. We can't be intimidated by patients by their anger. I had advanced people who come to see me in the training group at one point, and they said they terminated with their treatment with their therapist, their analyst, and I said, well, did you talk about it with your analyst? And they said, no. That's human. It's hard to talk about your disappointments with your analyst, about your analyst. But if anything, that's what you need to do in order to be strong and say everything. So we learn a lot here about interventions, and one of the things is, one thing you're going to miss in your first interview that could be very helpful and you might forget about it. That's just one thing. We can define transference, countertransference, and countertransference resistance. You may be familiar with all these things, but we'll define them and talk about them. And if there's unfamiliarity, you'll get to know what the concepts really mean when you're working with a patient. What is countertransference resistance? Good question. How do I react to questions? I wish I had a course where we went over and over and over questions that a therapist would hear and not know how to deal with. Like, can you tell me about your patient says, can you tell me if what your sexual orientation is? Or are you married? Or is this, how long have you been doing this therapy? People get short, they don't know what to say after these questions because they're not prepared. Even experienced therapists. A patient has a erotic feeling towards the therapist. I would like to make love to you, or I would like to. I'm not going to say what Trump said, but it could be that vain. A patient could be freely coming in and to you and saying things that would make you terribly uncomfortable. You have to be prepared to listen to everything. And if something is making you uncomfortable, this is a place to learn about it with Psychotherapy Training Group with me. Tuesdays. So I invite you to come and email me at marksehl@gmail.com, or you could email me here on LinkedIn. You just send me a message and say, I'm interested, I want to come. There's no charge for the first time, because I think it's an intimidating process to come here and think about talking freely. And I don't want it to be intimidated for you. I want you to feel welcome. You're going to go in here and you're going to be with me, and I don't seem like a bad guy. And so that might be reassuring, but I wanted to talk about it because people are not going to just come in to somebody who they don't know with a difficult assignment, which means, free speak. And by the way, you can be in the group and not say a word. And we have to know that we can tolerate patients' silence. They have a right to not do the task. The task is to speak. Supposing they can't, what do you do when you have a silent patient? How do you handle that? You don't want to make them feel terrible because they're not talking. And just like I wouldn't if you were here in the group and you didn't feel like talking, that's fine. As a matter of fact, I would know if once I got to know you, I might support your not wanting to talk. One time a patient came in to me and said, well, my former therapist said I didn't talk enough. Really? Well, maybe you talked too much with that person, and he didn't understand that. Maybe you talked too much. He didn't say you talked enough. So anyway, that's joining the resistance, though. Anyway, this is Dr. Mark Sehl for a little explanation about what the group is all about. We talk about interventions with suicidal patients. That's a tough one. People don't want to even hear patients say they feel like hurting themselves, or talk about the suicidal act. But it's very important how you handle that when the patient brings it up. Very important whether you can keep that patient or not. I think maybe if you heard I just did a podcast, by the way, on iTunes or the podcast app. It's about being in the box. Now, why did I think about it? Oh, you're in the box if you don't want to hear. The box says you don't want to hear something that's difficult to hear. So I just finished that. If you want to check it out on iTunes or a podcast, it's going to come out on Tuesday. And you can listen to the podcast a lot, and you can get in a sense of who I am, and also the 51 videos on psychotherapy on YouTube. What makes for a good psychotherapy session. A lot of people find them pretty helpful. All right, so I think I'm going to shut up right now and just say thanks for listening. And this Tuesday from 7 to 8:30, 330 East 46th Street. Give me a heads up in case there's a situation where we don't have any room. But you can teleconference, but I want you to let me know if you're going to do that on Skype, because my Skype name is marksehl, just 2 words, MARKSEHL. But I want you to let me know so I can be prepared for you being on the conference in that way. Okay, so long, marksehl.com, and I'll be looking forward to hearing from you about wanting to be in that. There's no charge by that first time also. There will be charges, but not for the first time, because I don't want to put you off by saying you have to pay for something that you don't really understand what it's all about. You can go to a lot of seminars and you can figure out about what they're about, but this is a little different. But I have been doing this for a long time. So my first group is full. They've been working now with me for 7 years. So, okay, and my 917-991-9113 if you want to text me. Okay, bye for now.